We're going to move on to our second panel titled Formalizing Inclusion, Proven Best Practices for Making Impactful Change Within Your Organization. It is my pleasure to introduce to you our moderator for this panel discussion, Robin Carter Cooper, who currently serves as Oakland County's very first Chief Diversity, Equity, and Inclusion Officer. Previously, she was the Executive Director of Diversity, Equity, and Inclusion for Rochester Community Schools. She is also a certified diversity practitioner. In addition to her bio that's listed in your participant handout, Robin's experiences include supporting national AIDS education services for minorities and LGBTQ education, as well as a high school classroom teacher and program director and lecturer at the University of Michigan Flint School of Health Professional Studies. She has developed and facilitated various social justice topics of discussion, presented at several conferences on the topic, and actively serves as a member of various advisory committees related to diversity, equity, and social justice. Robin, thank you for joining us this morning. I'll turn it over to you, and now I'll let you introduce your panelists.
Thank you, Ms. Justice. Thank you. Such an honor to moderate this panel. I always love these conversations, and with the panelists such as this, I think I'll be doing a lot of learning as we engage in this topic, so very excited. Many organizations want to do this work, and so I'm excited to hear best practices from the panel, but also I just want to remind you that as you're listening into the panel, make sure you're writing your questions on the card at the table. It's nice as you're listening to jot them down so that you don't have to remember at the end. At this time, I'd like to give the panelists an opportunity to introduce themselves, thinking about your name, your current role, what your organization does, and then maybe like where you are right now in the pandemic. So we can start with you, Jenny.
Okay. Hello, my name is Jenny Brown. I'm the CEO and president of a nonprofit organization in Rochester called Dutton Farm, and the owner and CEO of a social enterprise in Pontiac called Everybody Inc. So the nonprofit is an organization that supports adults with developmental disabilities in accessing their communities, accessing the workplace, finding the job of their dreams, and the opportunity to build skills for greater independence. And the social enterprise in Pontiac is a line of natural bath and body products to your right and my left that are manufactured and distributed by adults with and without disabilities working side by side at competitive wages, just to showcase that a business can be profitable while also being intentionally inclusive. Where we're at right now with the pandemic is still wondering what happened to 2021. We're all still trying to process 2020, but really just trying to understand what the culture is now, the changes and priorities of our employees after a lot of soul searching that we've all gone through with 2020 in 2021, and rebuilding based on all we've experienced. So glad to be here.
Hello and good morning, everyone. My name is Ashton Henderson. My preferred pronouns are he, him, his. I'm from the best city in America, obviously not where we are right now, but it will be after this, Tallahassee, Florida. Yes, Florida. I'm in for a rude awakening really soon. With that said, I'm a Spartan through and through. Bleak Green, I was a former Go Green. Got a big one this weekend. We'll
Go
talk
Irish.
about that at a different time. Jenny and I have already been beefing up here, but to that end, I'm so excited to be here and be with everyone today and be amongst this distinguished panelists and our moderator. With that said, my current role, I serve as the Director of Diversity, Equity, and Inclusion for the Detroit Pistons. At this juncture, when I was hired, I was the 10th person in the NBA in this role. That has now escalated to over 25 plus teams in our 30 markets. So I'm very, very excited on how this is rapidly growing globally and how we will continue to move the needle in this regard. So with that said, also my values are integrity, faith, family, discipline, determination, and drive. And with that, that's how I lead and try to show up every day within our organization and lean in from that standpoint. Where we are with COVID. Whew. So this past week, we started and are back in the office, fully operational with mask. So I'm really thankful to have that energy and synergy as we cultivate and create these environments for us to grow, learn, and continue to power humanity daily. We had an epidemiologist come this past week as of yesterday to give us an update and how we can all continue to be better and to be safe and help each other grow in the space of diversity, equity, inclusion, and also just showing empathy and supporting each other, which is grand and also important as we continue to lean in from that standpoint. But I'm very excited and look forward to this amazing discussion we're about to embark upon.
Good morning. My name is Kim Keaton Williams. I'm the Vice President of Talent Acquisition and Development and Chief Diversity Officer for McLaren Healthcare System. We are headquartered in Grand Blanc, Michigan. We have 15 hospitals. 14 of them are in Michigan, and we have one that we recently acquired in Ohio. We also have 2 health plans and a number of physician clinics across the state. And in terms of where we are with the pandemic, you can imagine being in healthcare, this has been an extremely challenging and stressful 18 months. You know, I think we all were kind of optimistic coming into the summer, you know, as the vaccines were rolling out. Fortunately, right now, this particular increase in cases hasn't hit us the way the others have, I think because so many people are vaccinated. But what we are dealing with right now is burnout from our employees. We have a very high rate of turnover. And so although our recruiters are doing an outstanding job of recruiting significantly more positions than we did a year ago, our vacancy rates, you know, especially in some of our critical positions like bedside nurses, are up. People are making a decision to leave the industry. And so retention is one of the hot topics for us right now. You know, how do we keep our employees going through this difficult time?
Thank you.
Thank you.
So as we jump into this conversation, I just want to name the fact that a lot of organizations want to focus on inclusion and DEI efforts, but they typically don't know when you're ready, right? Where do you begin? How do you sustain the efforts? And most importantly, how do you measure the impact? So that's what we're hoping to dive in today. So we'll start off with the first question for the panelists. What defines your company as ready to implement crucial diversity, equity, and inclusion efforts? Jump in.
Want me to start?
Sure.
All right. Sounds good. So I think there's multiple components that go into the readiness for your diversity, equity, and inclusion efforts. I think it starts with self-awareness as an organization or a company, really taking a hard look inward at where you're at and going beyond just who's a part of our team, who are our employees, and is there diversity, equity, and inclusion here? But going beyond that, looking at your marketing materials, looking at your social, and all of those different components, really to gain an understanding of what you are promoting and what you are celebrating internally. What holidays are you recognizing? And all of those different types of things. And I would recommend doing some kind of third-party assessment, right? Because you're never going to look at yourself with an unbiased perspective. So there's resources out there if you just do a little bit of research to start there. And then just making sure you are planning the work and working the plan, document it. If you are ready, then it should be documented, a detailed plan from high-level goals down to day-to-day tasks and objectives. And then, you know, of course, holding yourself accountable to those plans. And if you have that plan, that's not just sitting on a, oh my gosh, sitting on a. Oh my Lord. My
It's the
husband
mask,
is gonna
Jenny.
die.
It's the mask.
It's the mask. It's totally the mask. It's not just sitting on a shelf somewhere without being implemented properly, because employees know, your constituents know, your clients know when you just have a documented plan, just to be able to say you have a plan so you're fitting in with the trend to advance your brand. we have to do better than that. We have to have the integrity to write it down and then implement it and hold ourselves accountable to it. So start with understanding where you're at, giving yourself an honest look, and then having a plan written down that you are actually capable of, you have the capacity and you have the detail to implement the plan and hold yourself accountable to it.
Absolutely.
So I can add to that. There is a tool out there called the Global Diversity and Inclusion Benchmark, GDIB. It is a free assessment, and it's one that when we formed our executive D&I council at McLaren Healthcare, it's one of the first things we did because I know the culture of our organization is one that needs data and proof. And so we did an assessment. There's a 1 to 5 scale, with 5 being like best in class and 1 where you're basically non-existent in terms of strategies. It measures you across 14 different categories. It's not specific to any industry. And when we took the assessment across the 14 categories, we were at a 2, which was reactive or compliance mindset at best. And I needed that data. I wasn't surprised, but I needed our leaders to see where we are right now. The other thing that was important for our readiness is I needed our executive leadership team to be on board. You know, there are certain things that we have decided to mandate in our organization, such as unconscious bias training. You have to have senior leadership to help hold people accountable. And there are other initiatives that we're looking to bring along the way that might be tied to compensation based on progress with diversity initiatives. It's really hard to do that if your executive leadership team is not supporting that. But what I can tell you is, in my case, the mandate for D&I wasn't an idea that came from our senior leadership. So even if the idea doesn't come from the senior leadership, it doesn't mean you can't get them there. So in the case at McLaren, when I came in, I was responsible for talent acquisition and development. I saw a huge gap in the diversity of our talent, how we were recognizing the diversity in our patient base, what our governance and corporate leadership looked like, what our supplier diversity looked like. And so I reached out to 3 of our hospital CEOs to talk to them about why this was important for their business. And once I had them on board, then we took it up to our corporate senior leaders, saying this is a business imperative. And so then that's how we got the support. So depending on your organization, even if your senior leaders aren't quite there, if you can make the business case and get some champions to support you, you can push it up the chain, but then make sure that the senior leaders buy in on the accountability piece.
Very good. Ashton, what are your thoughts about that?
Yeah, I would first, I mean, everything that has been said is spot on. And I'll add this. I just think diversity, equity, inclusion is in the fabric of everything we do. And I think you're ready when you're ready to really be intentional about being challenged. And if everyone has the same thought process and the same mindset and mentality, we're not thinking. So it's important, and that's how we've leaned in as an organization to ensure that we were ready. Outside of this post being ready, there was a solid infrastructure already put in place for diversity, equity, inclusion practices. And this is a full-time job. This is not something that you can do while, balancing all the things you can. But I've been in spaces when I was in higher ed. I spent 13 years in higher ed at Florida State twice, Michigan State, and Clemson University, all in diversity, equity, inclusion roles. And those were in hybrid positions. And somehow I felt myself checking a box. And you're ready when you're committed and able and willing to do this every single day. When I wake up, I think about the equity, the inclusive measures that we can put in place to ensure that our employees feel safe, valued, heard, and seen, as well as have the ability to be their authentic selves and show up by putting things in place. But I think you're ready when you have a listening ear as well. All of us have strategy. All of us have plans and things that we know that fit our strategic plans and goals and core values. But what does that show up and fit within the organizational structure of the people that we serve? And that's something that was imperative for me to go in and have a listening tour because I have plans, but my plans are moot when it comes to if that doesn't serve the organization and who are the people that show up to work. So that's when I know you're ready to not only hear those plans, but actually activate those plans and see progress and count your small wins and have this and be fully integrated in, because it is in everything we do.
Absolutely. So as we talk about what it looks like to be ready, I want to move us to thinking about how do you start, right? A lot of organizations start with a council. They start with a team. People think you have to start with leadership. Some people say you actually can start at the bottom. What are your thoughts about how do you start to formalize the implementation of this really impactful, right, operationalized change in your organization? Dive in.
I'll go.
Sounds good.
I think me being 7 months into this role, but it feels like 7 years in a good way, because you hit the ground running. And it's something where I think for me, it's foundational principles. I'm at higher ed, I'm an educator by trade. I've always been in spaces where things are done with innovation. So I think where you start and having that ability to compound and bring people along is something that's really awesome to see. I can't be someone who, especially doing this work virtually, presents a certain challenge in itself when this is need to be done in this way by coming together, sharing each other's and our differences. But I will say that it has been, and how we started as a collective effort from our leadership and how we bought in and have buy-in to what we've started as the Power Humanity Culture Meeting, where we ensure that we have all the inclusive practices, structure, effective measures in place that we've heard from our employees, and how we can work across and around and through various organization and touch points to make sure that we have the solid mindset, the tools, the knowledge, skills, and abilities we need to be effective. And that started with the leadership, and that has permeated through our organization, and bringing that same energy and showing up and making sure people feel that. Because what you put out there is what you're going to receive. What you focus on, you find. And that's something in 11 seconds, you make 7 impressions on someone. So what is that feeling? What is that moment? And that comes from leadership, how it's ended where we are from an organization to what our outputs are going to be, and tracking our goals, outcomes, and measures that we want to see.
Yeah, so I'll talk about how we formalized it at McLaren. And I think what's important to think about is the culture of your organization and where you are right now. So for us, you know, this was a topic, diversity, equity, and inclusion. It was one that really wasn't talked about at McLaren. Your organization may be further along the journey. So when we did our benchmark and we looked across the 14 categories, and then we as a team looked at which ones we kind of rated our top 5 of the 14, which ones we thought would have the greatest impact on the organization. And then we ranked which of the top 5 do we think would have the ease of implementation. And fortunately, we saw 2 categories that fit both in the top 5. So for us, we focused on education first, because we had people that didn't even speak the language. What does diversity mean? What does inclusion mean? What does equity mean? What do you mean unconscious bias? And so we started with education. It was a very foundational piece in our organization that we rolled out across our entire system. The second piece that we said would have a big impact and ease of implementation was communication. Now, how do we start to communicate within our organization differently? Principles of diversity, equity, and inclusion. How do we start to communicate that externally? So that was kind of our first year. Then for us, again, this is not a one size fits all, but because we're very decentralized, we set up diversity and inclusion committees at each of our hospitals because we're spread out. And what the demographics look like and the challenges look like at our Petoskey Hospital might be different than what it looks like for our Carmanis Hospital in Detroit. So we needed to drive these strategies down to the local level rather than it solely being something done at a very high level. So those were 2 big pieces of how we started. It was doing the assessment and then prioritizing where we're going to get started. It's hard to address 14 different categories of gaps in an organization. This is heavy lifting. Some of the things we're working on now in terms of our patient data processes and clinical studies now, heavy lifting. But one thing you can do is look at making sure everyone has, a foundation of education and how you communicate internally.
So I'll just add that I'm a big believer in data and analytics, and you can't improve what you don't measure, but you can't measure what you haven't defined. So I think it's very, very important to define what is diversity, equity, and inclusion within your organization, because if you start with that definition, then you can start to gather data and analytics on how you are faring versus this definition. And if you're giving yourself an honest look at the data and analytics where you're currently at, so you have that baseline, then you're ready to start improving because you've measured where you're at. And if you start by acknowledging there's room for improvement, then that's a good start. That's a good way to formalize yourself, because there's documentation there, there's analytics, and there's data. And ideally, you want to start with leadership, right? You want to start with your board of directors or your leadership team. But if you don't have that buy-in yet, analytics are going to be really helpful for that. So even if you feel that, I would love to see improvement in this area or that area, start gathering your own analytics and doing your own research and getting those numbers, because it's hard to argue with facts. And then you can bring that to the organization, and hopefully that awareness will inspire and motivate leadership to create a plan for implementation. But formalizing by defining and gathering those analytics, and not just with your employees, as I said before, but how you're branding yourself, where you're marketing, where you're looking for talent, what does your social media look like, what do your marketing materials look like, where you're advertising. All of that matters, because potential employees need to see themselves on your marketing materials. And every time I walk through a business that has somebody with a disability in their marketing and advertising, I always take the time to email and thank them for being intentional, because very, very rarely do you see that. And it matters. Representation matters. So that's where I would start.
Thank you. Really great points. I think that all of the organizations that you're talking about are maybe looking at it from a different lens, but I think the foundational pieces are assessing first, right? Really thinking about where you are. And I think also, just to add, the idea that we do a lot of assessments internally, but also thinking about the assessments for your external. What does the community think? How are they receiving your services? If this is a school, how are your students receiving? Right? Because a lot of times we really do a lot of focusing internally, how our employees are feeling and engaged, and that's important. But what we don't want to do is forget that sometimes when we're giving ourselves a pat on the back, the clients that we serve don't, right? So it's a twofold conversation. And then I think the other piece to add, and I think that this was really defined throughout each of these, is as you're talking to each of your teams about the assessment, really helping them define their compelling why, right? Why are you compelled to lead this work, not just for your organization, but you as an individual? And what that does is it fits everyone into the conversation of equity, because for many, they feel very isolated to this, right? It's been kind of categorized as a race topic. And so if I'm a white male, maybe I'm having a hard time feeling like, how do I fit in this narrative, right? If I'm differently abled, I get it, right? But if I don't, then maybe I don't. So I think just making sure you connect all people in the process and helping them define their compelling why, so that they see how they fit in the big picture. The next question I want to ask is, how will your organization continue to sustain, right, your DEI efforts, keeping the movement fresh and at the forefront of the organizational growth? Now, panelists, as you answer that question and think about how to sustain that, I also want you to add in the idea of how do you build capacity? Because we often know these roles are a party of one. And so it's not a department, it's not a huge group. It's normally one, maybe two individuals really championing this for a very big organization. So what does that look like in terms of sustaining your efforts, but also building capacity?
So I can speak to the sustainability at McLaren. One of the things that as we were talking about moving forward on our DE&I journey, I said, we have to weave this throughout everything that we do in our organization. This cannot be an over to the side program, one of those extra things. We need to look at every part of our business. So we have 5 strategic pillars that our initiatives fall under. We have one for talent or our internal workforce. And so that's, employee engagement, succession planning, our recruiting strategies, looking at retention of employees, developing employees. Our second pillar is our patient pillar. And so to your point, not just internal, but our patients are our customers, and they are very diverse in terms of what their needs are. And so we have a pillar with initiatives under the patient one. The third one is our community. Not only do we serve our patients, but we want to be a great partner in the communities we serve. And there might be needs that we're missing if we're only looking at who our current patients are. So we also look at the community. The fourth pillar for us is corporate responsibility and governance. What kinds of policies and practices do we have in our organization that promote diversity, equity, inclusion? What practices do we have that might be barriers for people, not knowingly, but they might be barriers? What does our corporate board look like? Representation does matter. So what if you have a board that doesn't look like the communities you serve? And then our fifth pillar is supplier diversity. It's interesting that companies that have diverse suppliers tend to have higher market share because you get to tap into other markets. So now we have woven it throughout how we operate as a company. That's a big piece of how we're going to make this sustainable. Then to the piece of capacity, you're absolutely right. It is very challenging, especially when diversity and inclusion is new for an organization like it is for mine. You may not have large teams, whereas some of my competitive hospital systems may have 10 people, 100% dedicated to diversity and inclusion. The way I've implemented capacity is by launching those committees at each of our hospitals. And so it's still not a perfect solution. These are people who have other full-time jobs, but they're on the ground. They're champions for diversity, equity, and inclusion. I have different task force that I pull together for different initiatives. And so there's no way that one person or even 10 people can get this done at an organization our size. But fortunately, we have champions. We've even trained some employees to help train others on the topic of building inclusive leaders. And so I get very creative with how we resource this until I one day have a team of 10 people.
Yeah.
Kim, I can't wait till that happens for all of us. I will certainly take the 10 of 10. But with that said, I feel like all of us are champions of this work and champions of change, and us who are dear and passionate about this work. But I would say from our standpoint, from a Pistons aspect, growth and sustainability is essential to diversity, equity, inclusion, and practices of this work. And for us, I'm very thankful. In 7 months' time, we've been able to curate 4 employee resource groups that are fully operational and in market. We have an Ally Starts With All, which is our LGBTQ+, Bridge, which is our Black employee resource group, as well as our working parents. Cannot forget about the parents who are giving up a lot and sacrificing during this time and day and age, as well as just our Power group, which stands for Pistons Women Resources. And we started with 4 to really help with the growth and sustainability to continue these conversations across the scope of our organization. And it's been highly effective, and we lean on our ERGs for many different things, especially with thematic calendars. I'm a big theme person and love to celebrate and honor history and all the traditions and the value add that people bring to us every single day. So with that, honoring not only Hispanic Heritage Month through the dash of October 15th but 365 and 366 days in a leap year. With that said, we have a digest called Pistons Digest, which we look at the opportunity to lean into a company-wide podcast that we're going to listen to. Anything for Selena. That is what we've selected for this month, to learn more about how someone who's been gone for over a quarter of a century still the impact that this person has over an organization, a population of people, and it's something we're leaning into because education is the most powerful weapon you can use to change the world. And that's what DE&I is all about. Continue to educate, learn, and grow, and giving people permission to make mistakes because we're not omnipresent, we're not all-knowing, and that's something where we're all on this journey with you. And another element we've been able to lean into for growth, sustainability, and capacity is something I'm very, very excited about. We have just launched what's called the Power Humanity Leadership Lab. So this is a 10-month program, internal program. We have 25 employees ranging from coordinator all the way to SVP level, senior vice president, and they're learning strategy about diversity, equity, inclusion practices and principles through the realm of implicit bias, microaggressions versus micro-invalidations, Detroit perspectives. Detroit is 80% Black, the most segregated city in America. And it's different. When you come to this area, you just don't know that. So giving them a level set to have that understanding and knowledge base with that. And upon completion of this 10-month course, we meet once a month for 90 minutes. Each and every one of our employees are going to gain that skill set and the ability to foster and facilitate diversity, equity, inclusion practices across our organization. With that said, to lead coffee chats, to be administrators, to help champion this work, and to be an inaugural class of what we're building, which is something where I'm really, truly excited about because it's going to take all of us. And I truly believe, and I know someone mentioned in the last opportunity about the generational differences. Gen Z gets a lot of slack, but these young people are going to change the world. And I formally believe that. And I know that's why we're all connected to this work in this space, because it's going to take all of us to move the needle in areas in which diversity shows up, and inclusion and equitable practices that we have to interface and lean into more.
So capacity and growth is something that I get excited about. And I think it's important to understand that this topic of diversity, equity, and inclusion is not just the right thing to do, but it's a beneficial thing to do for your company, and really understanding the benefits of thinking differently about how you identify, recruit, and onboard talent. A lot of times when I'm talking with employers who are interested in working with us for hiring an employee from our organization, and make sure they understand those benefits, that companies that champion the cause or the hiring practices of hiring inclusively, specifically for adults who are differently abled. And I'm glad Robin is using that language, because even something as simple as that language changes the narrative on how somebody perceives somebody who is differently abled or has a developmental disability in bringing them into their company. But companies that do champion that cause outperform their competitors who don't have that as a part of their diversity, equity, and inclusion plan by like 30 to 40%. Shareholder returns, employee satisfaction, all of those things. So making sure that you understand first and foremost, it's a benefit to your company, and then lean in. You know, you're not by yourself. There are resources and there are people that want to help you, because you can't know everything about everything. And just make sure you collaborate and partner and lean in, because you can bring in experts that can help surround you and help you have those hard conversations in a safe way that help you improve. And then growth and capacity. If it's important to you, it's going to be on your calendar, it's going to be in your budget, and it's going to be on your strategic plan. Write it down, put it in your calendar, hold yourself accountable to it, and invest in it. You're going to invest in the things that are a priority to you, and your peers, your employees, those individuals that report to you, they can tell what your priorities are by where you're spending your time, where you're spending your money, and what you're talking about. So that's my thoughts on capacity and growth.
Thank you. I think you all have done a really good job of really engaging this topic around not just the solutions, but how are you including your employees? So I want to add a layer that we didn't originally have. And we talked a little bit about measurement, but I think a lot of people want to know, how do you measure this stuff? How do you know when it's working? What do your measurements look like for your organizations? I think that it's important, right, to look at the qualitative, how people feel, but I also think organizations, especially when we're thinking about the bottom line, want to know, how are you measuring? What are your your KPIs, your key performance indicators? So can you all share us with what that looks like in terms of how you're measuring your efforts and when they're working and when they're not?
I'll start, and I'm so excited to start because we just hired a new data analytics team, and they didn't even sit down in their office before I asked many questions about how we're going to measure diversity, equity, inclusion. So, and we actually met yesterday, since this is so new to our organization from an aspect of having someone in market. But what I do is track everything. I'm also, in terms of any touch points that we've had through company engagements and things of that nature. But it's been great to see over 50 activations. And what I mean by that is company either virtual meetings, coffee chats, anything we've had to power humanity throughout internally, externally, and things of that nature. I keep it on a spreadsheet. And I've been tracking that since I walked through the doors physically, but also virtually when I was working remotely in Florida. So having those touch points, what we did, what was the rationale, but also now leaning into this aspect of having real-time data points. So prior to me even having a session, what are we doing? Like, what's the why? I'm not going to waste your time. I definitely want to make sure you know why you're here, what are the goals, intended outcomes. So sending something what do you want to get out of this? How do we want to work together? What do you want to learn has been very effective for me. Then having the opportunity in the moment, because you have to capture the data in the moment or it goes to spam. So making sure that as soon as the event is over, we take time and build in the opportunity to give feedback or send it to an anonymous box where I receive that and continue to keep those KPIs and measures because that's so important. And I think it's also important to ensure that you're cultivating an environment where you can have candid dialogue, where folks can be honest about programming and things you need to shift or change. Because anyone can tell you, oh, that's great, that's awesome, and you feel good, but they're not coming. So that means that we have to change that narrative. So, and that's where our ERGs have come into really account of helping us get the data points that we need to grow. But I'm just really excited about this element and how I do is working on a semi-annual report that's going to go out for our entire company and how we're doing that. And the MBA is very, very helpful with outsourcing data company and analytics to help us ensure that we're hitting the measures that our goals and outcomes are, from a supplier diversity aspect, from hiring all the way down to who we are opening up and having bids to. So I think it's just such a great time as this, and you're going to see more just comprehensive planning and work towards it, because data drives decisions and data-driven decisions make the world go round. So I'm excited about that and be able to explain that and work with these dynamic individuals up here to steal their ideas.
How about you two? Is there any ideas that you're thinking about how you're measuring what you're doing with your organization?
Sure, I'll share some of them. One of the things we did for the first time is look at our employee engagement scores with a D&I lens. So we always measured our employee engagement scores in aggregate. But what was interesting when I looked at it by gender, by generation, and by race, I saw some differences in our organization. And that is one of the things that I've had, one of those crucial conversations with our senior leadership. Data is absolutely important. And, for most companies, the way to drive this is through being able to communicate the business case. So I shared with our senior leaders that the largest generational segment we have in our organization right now is millennials. And soon they will be the majority. They're not the majority, they're the largest generational segment, moving in the next few years to be our largest or the majority. These are people, the oldest of that millennial group, they're in their early 40s now. These are people that are moving up in leadership. So although our current senior leadership, mostly boomers and some Gen X, we can see the retirement shifts happening. We can see the millennials moving up. And I saw a lower engagement with our millennials. Employee expectations have changed. And I've had some of our senior leaders tell me, oh, the millennials, they'll change as they get older. I'm like, no, they're not. They're not changing. They know who they are. They know what their values are. To your point about Gen Z, I have a Gen Z daughter who told me just the other day that she was not interested in applying to a company because she doesn't like the way they treat their employees. This is a huge global company. Great opportunity for her. She said, no deal. I don't like the way they treat employees. So I looked at the generational differences. I looked at the gender differences in our organization. Our organization is 70% women. There might be differences in your organization and what women are experiencing versus men, especially if you see an organization where women make up the majority of your organization, but your senior leadership teams don't look like that. Also by race. People can have different experiences depending on what their race is in an organization. So employee engagement, I'm looking at retention. Now, right now I have that in aggregate, but I'm going to start to break that down. I know there was someone here from Consumers Energy. I think it was Consumers Energy that there was a panel I went to where one organization found that their working mothers were leaving at a higher rate. Now, obviously, that takes a lot of effort to dig into that level of detail, but retention of employees is not going to be a one-size-fits-all solution. So you really have to understand the diversity of your employees. We're looking on our side, our patients' health outcomes. There's disparity in care, there's disparity in health outcomes. I want, and we're moving towards this, for our dashboards for quality of health to show that D&I lens. So basically, you could take every important metric that you have in your organization and consider putting a D&I lens on it. It will tell you a whole different story than what you're seeing in aggregate. So make sure that your metrics are already tied to what your business values, whether it's the revenue, market share, employee engagement, employee retention, and then put a D&I lens on it.
Really great. I'm like, my mind's going and I'm like writing down a whole bunch of things that I can take. So I appreciate that and just being here so much. But I think going beyond just how do your employees and your constituents feel about the work that you're doing towards your D&I conversation and work, and what are those specific things you can measure, right? You can give surveys to your employees and all of your constituents to get that honest feedback and then be able to put that to work for you. But what other things can you measure? You can, of course, I've been, kind of pushing this point of a baseline. You need to know where you're at first, but what is that percentage of minority groups and differently abled groups and LGBTQ on your marketing materials? And how can you showcase you're improving those percentages and getting those different content that shows that representation? What holidays are you celebrating? And really taking a hard look at your unconscious bias, because we all have it, right? And you're probably leaning towards certain holidays that are more comfortable for you, and just taking a hard look at that. That's an easy way to measure yourself. How many trainings are you sending your employees to every year that are specifically around unconscious bias, microaggressions, and diversity, equity, inclusion conversation? I remember going to a training that totally changed my whole life. And we were doing this exercise, and I'll make it really quick, but we were making judgments through this exercise based on some very specific questions that were asked. And one of the questions was, how do you feel about this boss? Would you work for this boss versus this boss? Because this boss bought Christmas presents for everyone and this boss didn't give Christmas presents to anyone. And I was like, so rude. I would work for this boss. Well, I didn't know that this other boss that didn't provide Christmas presents was Jewish and didn't celebrate holidays. But he did, however, celebrate this other holiday that the other boss didn't. Anyways, that unconscious bias like hit me in the face, and I was like, oh my gosh, that was just life-changing to me. So making sure that you are documenting the trainings that you're sending your employees to, taking those surveys, percentages of your marketing and advertising, and then events attended. Where are you going to events? The events that you're going to, does everyone look like you and talk like you and act like you, and it's a comfortable place for you? Don't be afraid to get uncomfortable. And where are you sending your employees to for different events? And so if you're meeting people that are not in the percentages and in your plan, then go different places. Don't go where you've always been going before. So those are different things that you can document that are more specific.
Thank you so much. I think a lot of great ideas have just come from that. One of the things as we close out this and open up for Q&A is all of the measurements that they talked about are important, and you get to think about what measurements might be specific for your organization, but also consider not only what you're measuring, but how often are you measuring it. And so a lot of organizations will measure things annually, but sometimes when you do that, you've missed a lot of opportunities to fix it in the moment. So what are you measuring monthly? What are you measuring quarterly? What are you measuring annually? And then the other thing that I borrowed from being a teacher is data days, right? Creating a space where you allocate to look at your data. Because typically if you don't have the time, you won't make the space. So I think those are two things to maybe just add in thinking about implementing all of these amazing ideas that they have, being intentional in creating space to do it. I think at this time, we're going to open up for Q&A. Yes.
Good, really good question. So on our surveys, we don't ask that demographic data, but what we do is when we provide the employee data, like the reporting structure data, this is this employee, they work in this department, they report to this manager. We pull that out of our HR system. We also have that data of their birth date, their gender, and their race. So I, as the administrator or coordinator with our outside vendor, I don't see any of the results tied to the name, but our vendor can cross-reference and do that analysis for us. So they've always given me an employee engagement score. I said, I'd like you to go and now bucket this data for me. So I still don't know employees' names. If they don't have at least a certain number of people in a category, they won't show it. And I have intentionally not shared data with certain hospitals if I think the population is too low and it might, compromise someone's anonymity.
Any other questions? One of the things I'll add is that we're currently doing a cultural assessment in Oakland County, looking at all of our departments, all of our divisions, and we're doing something very similar. We're doing a third party to come out and look at all of those areas, not only how people feel engaged in their different identities, but what does our discipline data look like? I think a lot of times we forget to look at the people we're bringing in, how are we retaining them, who's making it beyond probation, what do our promotions look like? So all of those pieces are really helpful as you're thinking about initiatives, but also moving towards where you want to recruit. I think looking at where you're currently recruiting, sometimes we're looking for a specific demographic. And I hear this term often, and it's, well, we just can't find them. And so you have to really be thoughtful about where you're looking, where you're recruiting, and where you're seeking out talent, to make sure that you're getting what you want. And then I also think being very intentional about how you're naming diversity, right? Robin, we're really ramping up our diversity and hiring. And my question is, what does that mean? Racial diversity, gender diversity? I mean, you really have to be thoughtful about naming that. And I think for some people, it's a catch-all phrase. But if you're doing a catch-all phrase, you won't be able to isolate the data to see if you're successful or not. So I think those are things that you can really be thoughtful and intentional about. Anything else the panel would like to add in?
I would like to add in on that recruiting piece. It is a real challenge to sometimes hire diversity. I'll speak to healthcare. Our patient communities may have one, let's say, racial makeup, but then the pipeline of who we see in medical school might look very different. So for example, only 2.5% of the people in medical school now are African-American. And so we could use that as an excuse to say, well, we want to look like our patient populations, but there's no way possible based on the talent pipeline. So my push to my organization, and I challenge you to do this too, this is related to the equity piece. Be a part of the equity solution. You will not achieve the level of diversity and inclusion you want in your organization if you are not a part of the equity solution. There are underrepresented groups that have barriers and challenges. So one of the things that we're going to implement is a medical school pipeline for underrepresented students. So that means, people who are in college right now, a tough thing to do is to get through that MCAT. So we're going to have a pipeline program for underrepresented students that helps them prepare for the MCAT, gives them mentoring, helps them prepare for interviews for medical school, gives them job shadowing opportunities. We have to be a part of that pipeline solution, each and every one of us. And a lot of times there's kind of a mistake in thinking that, everybody has equal opportunity participate. Hey, we put scholarship dollars out there. How come nobody's taking advantage of it? It's great to have scholarships, but just know that if people have a economic challenge, they may not be able to stop working to go to and take advantage of that scholarship. So dig deep into the equity issue.
I would just add one quick thing as well, to not be intimidated by the ADA component of accommodations for adults who are differently abled and bringing them into your workplace. Start to think about this idea of universal design. And when there is an accommodation made, it doesn't just impact that specific individual, it benefits everyone. So if you think about walking into a grocery store and holding a whole bunch of things and the doors just open for you, well, that was created for somebody in a wheelchair, right? But we all benefit from it. You think about texting. We barely ever call each other anymore. We're always texting. Well, that was created for somebody that was hearing impaired. So if you think about making these accommodations, understand that it's going to benefit your whole organization or your whole company and not just that one individual.
And I'll just quickly add in, I would just challenge everyone to really chart your small wins. There's some things in opportunity. This work is daunting, it's tiring, it's exhaustive, but it's energizing when we see progress, we see growth, we see the opportunity to see the change in which we are constantly after each and every single day. Sometimes it's those small wins that bring you back the next day and bring you back to Friday, because as we all know, tomorrow's not promised. So we have to continue to show up for each other and provide those spaces and cultivate the areas that we want to see. So don't get, if you're just starting out, there's folks you can reach out to that are, and one thing I learned about diversity, equity, inclusion quick, this is not a proprietary measure. This is not, something that we hold deep and hold on to. People share, and that's something that you have to know and be comfortable asking, because you will get exactly the results in which you want to yield, and definitely the support you need to execute.
I think one more question. So I'll speak just briefly. Employee resource groups seems to be, the name. Sometimes you'll hear business resource groups. Years ago, they were more called affinity groups. I think the employee resource groups name is most common, and they are quite powerful. Most organizations that are using those rely on them heavily, just as you talked about, rely on them extremely heavily to drive D&I initiatives, bring ideas to senior leadership. We don't have a formal employee resource group for our LGBTQ community, but I can tell you there's enough people in that community once my role was created that they said, hey, our policy on this doesn't have the current language to reflect the LGBTQ community. And thank you for letting me know. We're going to fix that right away. Or we have an employee resource group for veterans. Not only do they support employees who are veterans in their transition
into civilian life, but they've also come up with ideas for our veteran patients, how they can honor them. So these groups are so powerful. We don't have a lot of them yet at McLaren, but that is one of the things on my radar. I just have to figure out how to implement it in a very decentralized organizational structure. It's a lot easier when you have most of your employees at one location.
Thank you so much for that. I think a lot of people want to know about ERGs. I know we have to wrap up this conversation. We could probably be here all day. So I think continuing the ERG conversation, there are a lot of resources out there. I will add that you want to make sure you have a formalized process for ERGs. We are looking at that, but again, it's really important to have a formalized process so that you don't have a lot of groups that are coming without structure. They're not aligned to your organizational vision and mission and goals. And then you also want to make sure you have a way to make sure that if you have to tell a group that's continuing to develop and grow that are against your values and visions, know that you don't have discrimination at bay, right? And so it's really important to be thoughtful about that process as opposed to letting people just come together without a formalized system on how you do that. So we're going to go ahead and close.